Well, hey guys, in today's video, we're going to talk about polycystic ovary syndrome. This is the most common hormone disorder in women of reproductive age. I know a lot of you all struggle with it, and of course it has various skin findings associated with it, skin problems that can be stubborn and difficult to tackle. In this video, we're going to be talking about the underlying root causes of polycystic ovary syndrome, why you have skin problems and hair problems, and I'm going to be going over conventional medications used to treat polycystic ovary syndrome, its various symptoms, but I want you to watch to the end because we're going to be doing a deep dive on a dietary supplement that actually has a lot of research to support its efficacy for addressing various problems in PCOS, including acne. All right, PCOS, polycystic ovary syndrome, it is a hormone problem and it's characterized by a few things. First of all, hyperandrogenism. Basically, excess male hormones, like testosterone, for example, either that can be detectably measured as being elevated or just that the body is showing signs of excess in the form of symptoms like hair growth in a male pattern that's called hirsutism, so facial hair growth on the chest. Women with PCOS notoriously have menstrual disruption, menstrual irregularity, abnormal periods, and as a result of that, they often later on will have difficulty conceiving. And many women with PCOS, if you look at their ovaries, they have these cysts, hence the name polycystic ovary. Lots of cysts. You don't have to have all of these features to be diagnosed with PCOS. You have to have 2 out of the 3. The root cause of PCOS is not one single thing. It's complex, as are most health problems, and part of its root cause is actually dysregulation of hormone release from a part of your brain called the hypothalamus. With PCOS, there is a problem with types of hormones called gonadotrophins. Gonadotrophins, specifically luteinizing hormone, LH, and follicle stimulating hormone, FSH. So if you look at the ratio between LH and FSH, it is abnormally high. So there's an imbalance there. The reason this is important is because those hormones, like I said, they talk to your ovaries. LH tells certain cells in your ovaries called theca cells to make something called androstenedione, which is an androgen hormone. Follicle stimulating hormone, on the other hand, it talks to cells in your ovary called granulosa cells, and it tells those cells to convert the androstenedione to estrone and estrogen using an enzyme called aromatase. But with PCOS, you have high levels of LH, which overstimulate those theca cells in the ovary, making excess androstenedione. So it enhances androgen production, leading to elevation in androgens. And that's where you see a lot of the skin and hair findings associated with PCOS, like acne, oily skin, hirsutism, we already talked about, hair growth in a male pattern. It can affect the hair follicles on your scalp, causing them to miniaturize, turn into a baby hair, and you get hair loss, specifically androgenetic alopecia. The problem with the elevated LH relative to FSH is that your ovary is trying to pick the best follicle to ovulate, okay, like an egg. But because you have a disruption there in those hormone levels, basically the follicle kind of gets stuck. So that gives rise to the appearance of those cysts. Again, not everyone who has PCOS will have these cysts, but many do, and this is why. The imbalance in LH to FSH arrests the follicle development, so you don't have normal ovulation. That's why you have irregular periods and problems with fertility. The other pressing hormonal issue with PCOS is a problem with the hormone insulin. Specifically, the body does not respond to it well. The cells of your body don't respond to it well, and as a result, you have insulin resistance, diabetes. Many women, not all, with PCOS also struggle with weight management, possibly related to this hormone imbalance with insulin or some other background genetic tendency, and being overweight, having obesity, also tips the scale in favor of insulin resistance, diabetes, and further problems with irregular menses and infertility. And all of these things together also exacerbate the skin findings, acne, oiliness, hirsutism, androgenetic alopecia. Just like not everyone with PCOS will have polycystic ovaries, not everyone with PCOS actually has insulin resistance. So just remember that PCOS looks different for everyone. Everyone has kind of a different makeup, different factors going on that play a role in the symptoms that they deal with. And so not everything is going to work for everyone in the same fashion, which brings me to the next point. How do we treat these issues? There are a few standard medications. One is combined oral contraceptive pills. Combined oral contraceptive pills, commonly referred to as birth control pills, because, well, if you take them, they, they're contraceptives. They're called combined because they have an estrogen component and they have a progestin component. Combined oral contraceptive pills are beneficial for PCOS because basically what they do is in PCOS, because you have that abnormality in the hormones coming from the brain to talk to the ovaries, the brain is trying to put out those hormones in an effort to get the ovaries to respond properly, but it's dysregulated. So the birth control pills come in and it's called a negative feedback loop. The birth control pills, the hormones in them, they say, shh, they quiet this down. And as a result, they can help to normalize the gonadotrophin profile and improve ovulation and get your period back on track. And they can help lower the levels of those androgen hormones that are causing acne, seborrhea, hair growth in a male pattern, hirsutism, and androgenetic alopecia. Even women with acne who do not have PCOS, like they have no problem with fertility, they don't have cystic ovaries, and they don't have other signs of androgen excess, in those women, using birth control pill, combined oral contraceptive pills also can help their acne as well because, as I've said before, all acne has a hormonal component. But in PCOS, the cards are stacked against you because you are in this hyperandrogen state, and those androgens are what are telling the oil gland to make more oil, driving the acne, driving the oily skin, the seborrhea. I have a video, as a side note, on the best birth control for acne, for the hormonal component of acne, so check that out because I go more into detail about the different types of hormonal contraceptive pills that can address acne. But if you know anything about birth control pills, they're not right for everyone, okay? They do have some side effects. Depending on other things that are going on in your life, they may not be right for you. They can increase the risk of blood clots, and they, have side effects. Some people don't feel themselves on them. They may cause some weight gain, which in the setting of PCOS is not ideal if you struggle with your weight to begin with. They also can cause melasma, a skin condition with hyperpigmentation. While women with PCOS struggle to conceive, it's not to say that they can't conceive, and many want to try. So you have to come off the birth control pills in order to try and get pregnant. Now, up until this point, the skin and hair stuff I've pointed out has largely been related to the androgen excess. But when you have the insulin resistance piece in there, that's also playing a role in driving more acne. But it also causes a skin condition called acanthosis nigricans, thickened, velvety, dark brown to grayish areas of the skin, often on the sides of the neck, under the arms, the sides of the face. That is a manifestation of insulin resistance. If you want to know more skin signs of insulin resistance, diabetes, check out my video on skin signs of insulin resistance. I'll link it down below. Well, a medication that I've talked about on here before is called spironolactone. Spironolactone is an anti-androgen, so it helps with the androgen piece of things, but it also can help improve insulin responsiveness. And it's nice because it kind of complements birth control pills so they can be used together. Having insulin resistance is not simply a matter of, oh, I have high blood sugar. It has a cascade effect to a variety of metabolic parameters that can have consequences for your overall health. For example, you can have abnormal blood lipids, cholesterol as a result of insulin resistance. Spironolactone works as an anti-androgen. It can complement the birth control pills, and it will help to improve acne. It helps to improve hirsutism, and it also helps to improve androgenetic alopecia, as well as reduce oiliness. These are all things that have to do with the androgen excess. And to a certain extent, spironolactone helps with the insulin resistance and cardiometabolic abnormalities in PCOS. Spironolactone is generally well tolerated, but it does have some side effects. It can cause breast tenderness and menstrual irregularities, probably the most common. And with PCOS, you already have problems with the menstrual cycle. So that might not be acceptable for everyone, depending on, if you're trying to get pregnant, then spironolactone, again, is not a good option for you because you can't take it if you're trying to conceive because it's not safe in pregnancy. One of the main players for addressing the insulin resistance is metformin. Metformin is a medication that works to decrease glucose output from the liver, and it also helps improve uptake of glucose into cells. So not only does metformin help with the insulin resistance, but it also can improve ovulation and encourage more normal periods in a regular menstrual cycle. So that is going to be helpful, especially for women who want to conceive. There are side effects with metformin. Specifically, it can cause some gastrointestinal upset, upset stomach. So again, not every medication is right for every person. And PCOS, again, does not look the same for everyone. Not all women have insulin resistance. Some women have more difficulty conceiving compared to others. A lot of women are not interested in taking birth control pills because of side effects. A lot of women don't feel like spironolactone is something they want to be on. They're not comfortable with the side effects. They develop them. Everyone, again, has their reasons for what they want to pursue with their own health. What if I told you there is a dietary supplement that has quite a bit of research to support its efficacy in improving many of the signs, symptoms, health problems with PCOS, including acne, including hirsutism. So much so, it's been investigated in PCOS dating back to the late 90s. So over 20 years of research showing benefit. The supplement, what is it called? Myo-Inositol. There are actually 9 different forms of inositol. So the Myo-Inositol is what I'm talking about here. It's a dietary supplement, but it's also naturally abundant in many foods that you can get in your diet. Myo-Inositol, as it turns out, is really, really important for what happens inside the cells after insulin binds to the insulin receptor. Okay, and it turns out that women with PCOS, it appears as though they have a problem at the level of inositol and how it regulates cell responsiveness to insulin. So getting in myo-inositol can improve a lot of what is abnormal in PCOS, including acne, including hirsutism. Where do you get myo-inositol? It's really abundant in fruit, beans, corn, and nuts. So quite high in those foods specifically. But they also have myo-inositol supplements that have been studied for PCOS in randomized controlled trials. If you go into the endocrinologic, gynecologic literature, you're going to find actually a lot of studies on myo-inositol and PCOS. Now, there's a lot of heterogeneity out there in terms of the studies, the doses that are used, the outcomes that they're measuring, the characteristics of the patients in these studies, but all of the studies do support beneficial outcomes for women with PCOS taking myo-inositol. Not only can it improve glucose uptake, but it can improve that hormonal imbalance. I'm not affiliated with any kind of myo-inositol supplement. This video is only for educational purposes. I'm not here to tell you, oh, go take myo-inositol. I'm merely giving you the information so that you're aware of it and something you can discuss with your doctor. Myo-inositol, it actually can improve the abnormal balance between LH and FSH that is, a problem in PCOS like we talked about. It also can improve your metabolic profile. So again, women who have PCOS, they often have a metabolic abnormalities, problems with things like not only their blood glucose, but also the lipids, triglycerides, cholesterol. It can improve the levels of LH, which are typically elevated in PCOS. It can improve that LH to FSH ratio. It can lower androstenedione, the androgen hormone that is playing a role in the acne, the hirsutism, the pattern hair loss. And it does improve acne. It improves acne quite well in women with PCOS. It can also improve the elevation in insulin, which ultimately can be beneficial for the signs of high insulin as it impacts the skin, namely that condition, acanthosis nigricans. Women with PCOS given Myo-Inositol, they show improvement in their total cholesterol, lowers. They also get an improvement in HDL, that's a good cholesterol, that is raised. Many women with PCOS who take Myo-Inositol, they also show improvements in their BMI, which, yes, I know is not a perfect metric. It has its flaws, it has its issues, but when it comes to treating PCOS, weight management for women who are overweight or have obesity is really important because it exacerbates all of the problems like menstrual irregularity, and the metabolic problems are further worsened by the excess body weight, and it's been shown to improve fertility. The improvements in acne and hirsutism are pretty significant. I will say comparable to at least what you can see with a birth control pill, a combined oral contraceptive pill. So for women who are not interested or a candidate for oral contraceptive pills, they're not interested or a candidate for spironolactone, and they're kind of feeling like, what else is there available? We have other acne medications, right, that can treat acne. Isotretinoin, a retinoid, not safe in pregnancy, right? You have topical retinoids, those aren't safe in pregnancy. You also have antibiotics, they're sort of a short-term fix, clear things up, not a long-term solution though. They're kind of, they suppress the inflammation, but they're really just used in order to kind of get a head start so that the medications that really work to control acne, like isotretinoin or spironolactone, have time to start working, right? Myo-Inositol appears to be a safe and effective alternative. What do I mean by safe? Okay, I've talked about this before, I'm gonna reiterate it. Whether it be this or any other dietary supplement out there, dietary supplements, they are not without the potential risks. They're not without risks of harm to human health. People have this misconception that supplements are safe, much better than a drug, but supplements, if they work, they're working like a drug, and they can definitely have side effects just like any prescription medication. So what are the side effects with Myo-Inositol? Appear to have no side effects. No side effects reported in any of these trials. Not only that, but we know it's safe in pregnancy. It's actually been used in some of the GYN and endocrinology literature looking at women with PCOS trying to conceive, going through fertility treatments, and showing success with Myo-Inositol. Now, that's not my area of expertise, so I'm not going to tell you, take this, it'll improve your fertility. But it has been examined in studies in women with PCOS trying to conceive. As with anything, it's not the poison, it's the dose. So the doses that have been used and that appear to be safe and effective, typically 2 grams of Myo-Inositol taken twice a day, so 4 grams total. 2 grams in the morning, 2 grams in the evening. Again, this video is for educational purposes only, to make you aware of this option. It's something that if you have PCOS, you're struggling with your acne, you're feeling defeated, something that you can now go to your doctor and talk about, hey, is this an option for me? I'm not telling you to take it, I'm giving you the information that this exists out there. Can you use it alongside other medications? Yes, there are studies looking at Myo-Inositol combined with, say, combined oral contraceptive pills, and showing that women get better results with both together than either alone. So say you're on one of these treatments, you're getting good results in terms of clearing acne and seborrhea, but not 100%. There's evidence to support adding Myo-Inositol to the regimen as a safe and effective way to get better results. Can improve acne significantly, hirsutism significantly. No research on it though for androgenetic alopecia. There's not a lot of research directly looking at seborrhea, but patients who take this often do report an improvement in oiliness, but it does improve insulin responsiveness. That's Myo-Inositol, a supplement that actually can work, actually has a good track record of safety and efficacy, specifically for women with PCOS. Now, what if you don't have PCOS, but you're a woman with acne and you've tried things like birth control pills, spironolactone, which are not exclusive to treating acne in women with PCOS, because again, all acne has that hormonal component, and these are medications that we use in women to treat the hormonal aspect of acne and help control it. But what if you've tried those things, or again, you want to get pregnant? Is this something that will be effective for you? What I can tell you is there are no actual studies really looking at this supplement outside of PCOS. However, women who just have acne do appreciate an improvement in their acne when they take this, but we just don't have the research to support recommending it outside of PCOS. What about men? Is this effective for acne in men? We don't know if it's effective for acne in men. Safe for men to take, and research does suggest that in men who have problems with sperm counts, they're struggling to conceive with their partner because of sperm problems, inadequate sperm counts, or maybe a motility issue. The research actually does support that Myo-Inositol can be beneficial for improving that. Now, that's outside of my area of expertise in terms of fertility. So the research exists out there. Talk to your doctor about it. There are treatments with good track records, but not every treatment is going to be the right track for every person out there, okay? So that's why I'm making this video, because I know a lot of you guys ask, what else is there? What else is there? I don't want to do Accutane. I can't do Accutane. I can't do spironolactone. I can't do birth control pills. I want to get pregnant. Surely there's something else out there. Talk to your doctor about this, because there's good research for this. It's safe, it's effective, and for PCOS specifically, it definitely has a long-standing track record showing efficacy. Now, that being said, the research has its limitations. Again, there was a lot of heterogeneity out there, so there could be groups of people with either PCOS and or just acne for which this does not work, okay? For which this just does not work. More research is needed, but definitely worth having a discussion with your doctor, especially if you've been feeling very frustrated with the available treatments out there for things like acne, hirsutism, androgenetic alopecia, although again, it hasn't been studied for androgenetic alopecia. Anyway, y'all, I hope this video was helpful to you. If so, give it a thumbs up, share it with your friends, and as always, don't forget, sunscreen and subscribe. I'll talk to you guys tomorrow. Bye.